So I finally got my first COVID shot on this past Wednesday, May 19th at 8:10 a.m. I live in London, Ontario, Canada. I went to get it at a place called, I got it done through the Middlesex London Health Unit. Went to get it done at Western Fairgrounds, the Agriplex. Yeah, Western Fair Agriplex at 845 Florence Street in London, Ontario. So basically, you're not to, they don't want you arriving more than 10 minutes before your appointment because they don't want to have a bunch of people crowding around and all that during a pandemic. So when you go in there, they will, you just let them know you're there for your appointment. They have it very well organized. There's several different people working there. So I think the first person, you let them know that, you're there for your appointment and all that stuff. And what they do is they have you fill out something called a demographic form, I think it is. Like, just basically, it's a basic form with your name, address, email address, phone number, and your health card or whatever piece of ID you're using to get your COVID shot. And by the way, at least in Ontario, Canada, you do not have to have an Ontario health card to get a COVID shot. So, like, if you're new to Canada or you're just a visitor or whatever, you do not have to have a health card to get a COVID shot. So, after you fill that form out, you'll take that over to someone else. They'll send you up, and that person that you take it to, you take it along with your piece of ID, and they will right away, they'll give you a card like this stating when your second appointment is for your second dose. And mine is September 8th. So 112 days after my first dose was given. And then once you've gotten that card, you will go to a waiting area and they'll have you wait. I didn't have to wait in that waiting area. Like, by the time I was walking over, they just said, don't worry about sitting down or anything like that because your group's going in right now. So I went in. They'll tell you which nurse to go to. You'll go to that nurse. The nurse will even tell you her his or her name and everything. And they'll ask you a series of questions, such as what kind of medications you take, if you have any health conditions, if you know of any medical allergies, like if you're aware of any allergies to any types of medicine or ingredients that could be in the COVID shot, stuff like that. Like, they'll ask you some basic medical questions. And they'll ask you which arm you want the shot in. So since I'm right-handed, I got the shot on my left arm. So basically, the same part of your arm where you get a flu shot, it's given, I think it's called intramuscularly. So it's basically in your upper arm, like in your bicep, or like basically, yeah, it's given in your upper arm, it's given into your muscle. It's very quick. Like, I mean, it happens before you even know it's done. So once they give you your shot, they will take note of what time they gave you the shot at. And they'll even put like at this particular facility, they even put a sticker on all their patients there, like on their pants or on their shirts, saying what time to sit in the waiting area till. So my shot was given at 8:21 a.m. So they gave me the sticker saying 8:36. So I went to sit down in that area and wait there for 15 minutes. And the reason why they want you sticking around for at least 15 minutes after you've gotten the shot is just so they can observe you to see if there's any kind of, if you're suffering any kind of adverse reactions, any kind of adverse, unexpected effects from the shot. such as lightheadedness or anything like that. And then once that time hits, you're able to leave at that time. So a few things to know about the COVID shot. So I got this sheet of paper from the Middlesex London Health Unit. Serious side effects after receiving the vaccine are rare. However, should you develop any signs and symptoms that could be an allergic reaction soon after vaccination, seek medical attention right away from the clinic staff or call 911 if you have left and are severely unwell. Symptoms of an allergic reaction include hives, which are bumps on the skin that are often very, very itchy, swelling of the face, tongue, or throat, difficulty breathing. Your healthcare provider will inform your local public health unit of any serious side effects after receiving your immunization. Reports of adverse reactions to vaccines are sent to the Public Health Ontario and the Public Health Agency of Canada. If you have any concerns or questions after your immunization, please call your local public health unit. What should I expect in the next few days? Similar to medications and other vaccines, the COVID-19 vaccine can cause some side effects, although not everyone will experience these. Most side effects are minor and don't last very long. Examples of some side effects associated with the COVID-19 vaccine may include pain at injection site, redness, swelling, tiredness, headache, muscle pain, chills, joint pain, and fever. A cool, damp cloth or covered ice pack on the area where the vaccine was given may help with soreness, and if needed, medications such as acetaminophen or ibuprofen may be given for the pain or fever. And in my case, I got the Pfizer-BioNTech vaccine. So here it says Pfizer-BioNTech vaccine, very common and common side effects, may affect up to 1 in 10 people. Pain at injection site, fatigue, headache, muscle pain, chills, joint pain, fever, diarrhea. Uncommon side effects may affect up to 1 in 100 people. Axillary swelling and tenderness, enlarged lymph nodes. And if you happen to get the Moderna 2 vaccine, some of the very common side effects may affect up to 1 in 10 people. Pain at injection site, fatigue, headache, muscle pain, chills, nausea, vomiting, axillary swelling and tenderness, and large lymph nodes. And uncommon side effects may affect up to 1 in 100 people is fever. And things to remember after you receive the vaccine: continue to follow the recommendations of local public health officials to prevent spread of COVID-19, which include wearing a mask, staying at least 2 meters from others, and limiting or avoiding contact with others outside your household. Ensure you return for your second dose of the vaccine. If you receive your first dose at a community clinic, you will be provided with the date of your second dose appointment. If you receive your first dose elsewhere, follow the instructions of the healthcare provider to ensure you receive your second dose on time. The second dose is required to build adequate immunity and provide protection against COVID-19. Avoid receiving any other type of vaccine or TB skin tests until at least 28 days after receiving either dose of COVID-19 vaccine. Women should avoid pregnancy for at least 28 days following this vaccine. Keep this sheet of paper and your printed COVID-19 vaccine receipt from today for future reference. And then it just basically says this guidance provides basic information only. It's not intended to take the place of medical advice, diagnosis, or treatment, legal advice, or legal requirements. Please check the Middlesex London Health Unit and Ministry of Health website for updates, information, and other documents. So my personal side effects, the only side effect that I got from getting the Pfizer vaccine was that on the day when I got it, My arm was a little bit sore that afternoon. It's by no means it wasn't severe pain at all. Like on a scale of 1 to 10, with 1 being not hurting at all and 10 being excruciatingly painful, I would say the pain was like a 2 or 3. Like it was there, but it wasn't enough to stop me. It didn't limit me from using that arm or anything like that. I still had full motion and full movement of that arm, and it didn't affect how I used it. And a lot of people talk about how it's the very next day after the vaccine that you really start to feel the side effects. Well, the day after the vaccine, yes, I was feeling some soreness in that arm. Again, the pain was about a 2 or 3 on a scale of 1 to 10. But by Thursday afternoon, the day after the vaccine, I wasn't feeling anything at all. It went to a point where I was just feeling it a little bit if I moved my arm in certain ways, and then it got to a point where I didn't feel it at all. So just keep in mind that your chances, they are going to screen you. So it's not just a case where you're just going to walk in there and you say you're there for the COVID shot and they just say roll up your sleeve and they give you the jab. No, they're going to ask you a series of medical questions, what medication you take, if you have any medical conditions, if you know of any medical allergies, stuff like that. So they're gonna screen you, and the people that are giving these injections, at least in Canada anyways, are trained, qualified medical professionals, people such as nurses, doctors, pharmacists. I know here in Ontario you can get your COVID shot either. There's some drugstores that are giving COVID shots. There's community clinics like this one that I went to. Possibly some doctors' offices might be giving it. I'm not too sure about that. So you can just Google COVID shots in your area if you're interested in getting the COVID shot. And just keep in mind your chances of getting a serious side effect from the COVID shot are extremely slim. Like even the AstraZeneca shot, which is not currently being given as a first dose in Ontario and throughout most of Canada, even that AstraZeneca shot, the absolute worst case scenario for that, there might be as many as 1 in 26,000 people that get blood clots from the AstraZeneca shot. Like last I heard, there was over 2 million AstraZeneca shots given in Canada. Last I heard, there were 12 people, out of those 2 million AstraZeneca shots, 12 people got blood clots, and 3 of those people died. So 12 blood clots out of 2 million, or on a very worst case scenario, I think I heard some Nordic countries were saying that it might be as high as 1 in 26,000 people that can get blood clots from the AstraZeneca shot. 1 in 26,000, that basically means out of 1 million people getting the AstraZeneca shot, 38 people would get blood clots. So the risk of getting seriously ill from the vaccine are very low. Like both my parents have gotten the vaccine, the first shot, and my sister's gotten the first shot. My dad and my sister got the Pfizer vaccine. My mom got the Moderna vaccine. My dad didn't feel any side effects at all. My mom just felt a sore, heavy arm for about a day or so afterwards. My sister, the same thing. She had a sore, heavy arm for about a day afterwards. Like the day after she got it, yes, her arm was so sore that she couldn't raise it above her chin, but that only lasted for like a day. So either you're more than likely you're not going to get any side effects at all, or they're just going to be very mild side effects. And in my opinion, everyone who is able to get the COVID shot should get the COVID shot. Like I know right now, I think in Ontario, it might even be right across Canada, I'm not too sure, but at least in Ontario, I think anyone 12 or older is able to get a COVID shot now. And I think for 12 to 15-year-olds, I believe it's the Pfizer shot they're giving. In my opinion, the only people that should not get the COVID shot are people that don't meet the age restrictions or people that have medical reasons for being unable to get the COVID shot, such as, if you might be allergic to some of the ingredients in the COVID shot, if you've had a serious reaction or it's believed that you'll have a serious reaction to the COVID shot, or if you've had serious reactions to previous vaccines. Basically, unless a qualified medical professional tells you that you shouldn't get the COVID shot, or if you don't meet the age restrictions for getting the COVID shot, then you should get the COVID shot. And in my opinion, anyone who's able to get the COVID shot and chooses not to get the COVID shot is just plain fucking stupid and selfish. I can't stand these fucking anti-vaxxing retards, idiots. And to me, religious grounds is not, I don't take religion seriously. I'm an atheist. I don't believe in God. To me, religious grounds is a pile of shit. In my mind, if it's against your religious beliefs, well, maybe sometimes it's worth it to go against your religious beliefs or maybe even change religion. To me, religion's a crock of shit. So unless there's a medical reason or unless you don't meet the age restrictions, get the COVID shot as soon as you're able to. You're helping yourself, you're helping your family, and you're helping your community. And at least across Canada anyways, the COVID shot is free of charge. And I know in the Canadian province of Ontario, you don't even need to have a province of Ontario health card or OHIP card to get the COVID shot. So just check your local health, just Google COVID shots in your area, check with your local drugstores, your local health department to see how to go about getting the COVID shot. And let's all do our part and try to end COVID. COVID's been around for way too long. COVID needs to be gone.